So, I'll be talking about brachytherapy today. Before that, what exactly is brachytherapy? So, radiation can be given either by teletherapy or brachytherapy. What does teletherapy mean? You are giving the treatment from a distance, so it is like far away. You can see that this here will be the source and here will be the patient. So you are giving the radiation from a distance, and it's like external. So external, you're using either linac or telecobalt to uh, undergo the teletherapy. So brachy means near. So this means near. So your the treatment source. If this is the treatment source, this will be near to the patient. The treatment's body cavity, or sorry, anything related to the patient, and the treatment is usually internal. The sources, sealed sources. So we use the sealed sources. For example, cobalt 60, cesium, or iridium. So these are the types for sources for brachytherapy. Now coming to brachytherapy per se, what are the types? So there are different classification for brachytherapy types. Now brachytherapy types based on the implant types, how the implant is being put in this case. So in this case, it is first is cavitatory, where the natural body cavities are used, and there you are keeping your sources or the applicators. So in this case, it is like cervical carcinoma, so where you are using intracavitatory applications. Here it is like endometrial carcinoma, where they have removed the uterus, and this is the vaginal vault. Here vaginal cylinder has been used as the intracavitatory applicator. Now next, coming to interstitial, where the needles or catheters are used uh, to and directly positioned inside the tumor or the tumor bed. For example, this is the prostate, where the interstitial needles have been piercing, or for the example, this is a tongue in head and neck cases where tongue brachytherapy is given. Like these are the needles, and or a breast interstitial treatment was used to be given initially also. So these are the needles which are piercing the breast. So these are the types for interstitial. The examples. Now intravascular is where it is given inside, where the needle catheters are inserted inside the artery for cases to prevent restenosis. So cases where stenosis is very common, so to prevent restenosis, you can use this intravascular. Now intraluminal is natural lumens, so natural tubes. Your natural tubes, the sources or the catheters are being put here. So example, inside the bronchus or inside the esophagus as well. So esophagus, intraluminal brachytherapy. Now next, coming to surface mold, where it is usually used for skin lesions. So it is obviously on the surface, so you can use either the wax material in which you have kept the your radioactive sources, or needles have been pierced in the wax material, or something that you have used for surface mold formation. Then you apply the mold to the patient's shape as such. So if the tumor is here on the nose, so skin lesion, so you're applying it like that. Now this was about the implant types. Now coming to dose rates. Based on dose rates, brachytherapy is divided into low dose rate, medium dose rate, and high dose rate. Low dose rate, where per hour less than 2 gray is being gone to the patient or the treatment. So if you're using 2 to 12 gray per hour, then it is more medium dose rate. High dose rate is more than 12 gray per hour. Now next, coming to treatment duration, permanent or temporary. So here, permanent, like they used to keep it in the iodine. Permanent, where there is shorter half-life, and the radionucleotide, it's like for the whole lifetime of the radionucleotide, and usually it until the completion of the radioactive decay that works, and the patient is sent home after a while to the after keeping the uh, permanent radionuclide. So, and temporary is where you will remove the sources that you have kept in the patient after a prescribed dose is reached. So you want certain prescribed dose to be treated for a patient. The patient will be in the hospital. So once this prescribed dose is reached, then you will remove the applicator or the source. These the sources for this are usually having long t half or half lives. Next is based on source loading. If it's preloading or after loading. What does preloading means? If this is the applicator, then this is the source. Then before applying to the patient itself with the applicator and the source, it's all ready, and then you place it in the patient. Now after loading means first you place the applicator in the OT or like OR, then in the patient, and then afterwards you will load the source. Then now this loading the source is either manual or remote. Either manually the clinician is loading the applicator with the source, or the machine, that is automatic remote after loading machine, that either that or this.